Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, recent advances or new drugs which are available for prophylaxis of multiple sclerosis. So, the new drugs which are used for prophylaxis of multiple sclerosis are we have glatiramar acetate, metoxantrone, then interferon beta 1A and interferon beta 1B. Then we have natalizumab and alemtuzumab, alemtuzumab. Then we have fingolimod, cladribine, dimethyl fumarate. So these are the new drugs which are used for the prophylaxis of multiple sclerosis. Then we also have one more which is teriflunomide. Right. So these are the drugs which are used in the prophylaxis of multiple sclerosis. One more which is ocrelizumab. Okay. So among these important is interferon beta 1b 1a. Actually this interferon beta 1a beta 1b is the best initial drug of choice. Number one. Next we also have this natalizumab is also important. This natalizumab will actually it is an alpha 4 integrin inhibitor. But the main problem with natalizumab is it has a side effect. It can cause progressive multifocal. It can itself cause progressive multifocal leukoencephalopathy. Okay. Next we also have fingolimod is also important. What is this fingolimod? Fingolimod is a sphingosine 1 phosphate inhibitor. It is a sphingosine 1 phosphate inhibitor. This fingolimod will inhibit or it will prevent the lymphocytes uh, releasing out from the secondary lymphoid organs. Then cladribine. What is cladribine? Cladribine is a purine analog, and this cladribine will actually prevent or inhibit DNA synthesis. It will inhibit DNA synthesis, and it will also inhibit the repair of the DNA if required.
thank you and thank you for watching.